While a new report shows many rural hospitals across Texas are in danger of closing when federal COVID funding runs out, one health system in our area tells us it is strong enough to take the hit and stay in service.
KCBD News Channel 11's Brittany Michelson gives us a look at how the Linn County healthcare system has adapted to survive.
We're here. We're not going anywhere anytime, and we are surviving.
While it's been a tough few years, CEO Melanie Richburg wants people in and around Linn County to know their hospital system is healthy.
So that's in your primary care settings. That's in your family practice with your physicians and nurse practitioners. That's finding the people with heart disease before they have the heart attacks, or finding people that potentially would have breast cancer by getting the screening mammograms done. And so that is what we do, and we do it really great.
The pandemic made it more challenging, with an onslaught of patients, more needing critical care, and a third with no insurance.
You know, we absorb a certain amount, and we budget to absorb a certain amount of what we call uncompensated care every year. But when that budgeted amount doubles, in our case triples, it does cause struggles for communities.
The system has made several changes to adapt, shifting supply schedules to save on fuel costs, opening a fast-track clinic to keep people out of the ER, getting a ventilator and training staff how to use it, to name a few. It used CARES Act federal funding to build a training classroom and new ambulance bays. One was left open for drive-through care during the height of the pandemic.
When people look at us, and if you look at our income statement, our balance sheet, you say we've had increased our assets through the last couple of years. How did you do that with COVID? Well, we took the money we had and we spent it because we had to, but we created things that are going to give to this community long term.
The district has expanded services in different ways in O'Donnell, Wilson, and Post. She says the hospital needs a new emergency room, and while the funding isn't there yet,
I don't want any of them to be worried that they come out here and the doors are going to be locked, because that is not even in the worth having a conversation about. We're doing good. Did we struggle the last 2 years? Yeah, but it wasn't all because of financial. It was just because of the pandemic and how it was impacting all of us.
While rural hospitals have struggled, Richburg says profits for insurance companies are only going up. Brittany Michelson, KCBD News Channel 11.